The next patient, yes. Oh, hi there. I didn't even see you. You're here for your full body medical examination? Right. Okay. Can I confirm your first and last name? And your address? Still at the same address? Okay. And did you have your health insurance with you today? All right. Thank you so much. Take that card from you. Thank you. Just a few health questions before we get started. Do you smoke? Do you drink alcohol? Okay. Do you take any medications? Any prescriptions at all? Do you take vitamins during the day? Any history of diabetes in your family? Heart attacks, strokes, any diseases at all? Okay, any thyroid issues? Okay, anything particular that I should be focusing on today? Okay, thank you. All right, that's enough with the questions. I'm just going to be putting my gloves on, okay? And I'll be starting your medical exam. Do you remember what you had to eat for breakfast? Okay, and what day it is today? Tuesday. Correct. And what's your favorite color? Awesome. That's actually my favorite color too. So we're going to start off with your vitals. Okay, have you ever had your vitals checked before? All right, so this is where I check your oxygen levels, your blood pressure, etc. Okay, so we're going to start off by just listening to your heart. Is that okay? We'll be doing a few exercises where you breathe in and breathe out, okay? So I'm going to have you start off by just breathing normal. Okay, I'm going to listen here. Okay, now I'm going to have you breathe in. Breathe out. Good, I'm going to go behind to the neck here. Underneath your lungs. Can you breathe in? Breathe out. Breathe in. Breathe out. Good. So your heart sounds really good, really strong, and your lungs also sound really good. So what we're going to do next is check your temperature. This is going to go above your forehead down to your neck, okay? Should be super comfortable, okay? So if you could just look straight at my nose. Okay, underneath. And good, okay. Your temperature is 89.5, which is totally normal. Now we're going to check your pulse and your oxygen with this little device. And I'm going to have you put your finger in there like that, okay? And then I'm going to hold your hand. Okay, just put your finger in there. Perfect. I'm going to count to 3. 1, 2, 3. All right, your oxygen is 95 and your pulse is 98 beats per minute. So that's really, really good. Now what I'm going to do is just check your pulse one more time. Can you hold your palms up? I'm just going to press on your palms and make sure that they're even. So I'm just going to count. Good. I'm going to check your neck as well, just to make sure, okay? Could you just relax for me? Good, okay. Now I'm going to check your blood pressure with this blood pressure cuff. Have you ever had your blood pressure taken before? Okay, you're gonna feel a slight tightness around your arm. It should not hurt, okay? If it hurts, just let me know. Definitely shouldn't hurt. Okay, so I'm just gonna have you put your arm through here. Good. And I'm just gonna put this right on your arm right here, okay? Okay, and we're gonna pump. can feel it? Okay. Just getting the reading here. Good, okay. Your blood pressure is very normal, so that is good. Gonna put this down. Okay, so while I have the stethoscope here, I'm just going to check your heart rate one more time, okay? So can you breathe in, breathe out, breathe in, breathe out? Good, everything sounds top notch. Okay, that is awesome. Your vitals are perfect. What we're going to move on to now is your facial sensation to see if you can feel me doing this on your face, okay? And rubbing my hands through your hair, okay? So I want you to just tell me if you can feel it or if you feel any pain, okay? I'm gonna start by tapping on your face. Could you just look at my nose or behind me? Whatever is comfortable for you, okay? So, how does that feel? Good. And above your forehead. Okay. Your right cheek. Okay. And your chin. And your nose. Boop, 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 boop. Beside your nose. On the other side. On your eyebrows. Okay. And your ears. Does that hurt at all? Your ears. Okay. I'm going to feel your thyroid. Okay, right here, your thyroid and your tonsils. Gonna check to see if you've got any swollen tonsils, okay? So, can you feel that there? Okay, your thyroid feels good. Tonsils don't feel swollen. Awesome. Okay, now I'm going to just go over your clavicles really quick, okay? Your clavicles are your bones right here. These bones right here? Okay, you know what they are? All right, I'm going to tap, 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 tap. Okay, do they hurt? Amazing. Now I've got something here, okay? This is my little reflex device, and I'm gonna check your reflexes on your shoulders. I'm gonna put my finger on your shoulders and go, and I want you to tell me if it hurts, okay? But I'm gonna look for mostly just your reflex, okay? Good, okay. Good. Now I'm gonna go down your arm up to here. I'm gonna put 2 fingers on your arms like this and tap, and I wanna see your arms move, okay? So we're just gonna go right there. Good, and right there. Good. That is awesome. Your arms moved. That's what we were looking for. Now I want you to tell me where you can feel this on your face, okay? I'm going to be using my brush. And I want you to close your eyes and tell me where you can feel this on your face, okay? Good. Your nose, forehead, cheek, nose, lips, eyes, eyebrows. Good, okay. Now I want you to tell me if this is warm or cold on your face, okay? So just tell me if this is warm or cold. Super cold. And still cold. And still cold. Good. Now I want you to just tell me if this is sharp or dull on your face. Okay, and this. Good, and this. Good, and this. Good, and that. And this. And this. Okay, good. And now I'm going to tweeze your eyebrows. Can you tell me if you can feel that? Yes, you can feel it. Good. All right, now I want to check your sensation in your arms. Okay, if you could just hold out your arms for me, and I'm just going to go on your arms and tell me if it's comfortable. Tell me what it feels like, okay? Sort of a spongy-ish feeling, right? Super comfortable, right? And your other arm? Good. Can you tell me if this feels different? Did this feel different? And this? Good. One more time. And one more time. And one more time. Was that comfortable? I know, it's like a super comfortable feeling. Right. Now, I'm going to just double check your hair, okay? So what I'm going to do first is check your scalp. So can you just relax? Okay, I'm just going to go through your scalp. Okay, it looks like really nice. Your hair looks really nice, super thick hair. Very beautiful. I'm going to use my sticks to go through your hair, okay? So we're just going to look at the scalp. Yeah, the scalp looks really good. Nothing to worry about. I don't see any alopecia in your hair, which means your hair is not thinning out, okay? And everything looks good on this side. Yes, really, really good. And the back of the head? Good, okay. Now, I want you to just tell me if you can feel this in your hair, okay? Do you feel that? And do you feel that? Good. Okay. I'm glad you could feel that. That means that you have sensation in your scalp, which is important to look for. All right, now that we're down to your belly, I'm going to tap on your belly, okay? I want you to just tell me if it hurts once again, okay? All right, we're going to tap, 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 tap. Any pain? Okay. Now I'm going to go like this on your legs. Can you tell me if you feel any pain? No? Great. And then I'm going to tap on your feet. Do you feel this? And this? Nice. Okay, that's great. We're going to move on to an eye exam. Okay, first I'm going to look into your eyes with my light. I'm just going to examine them. If you feel like the light is too bright, just let me know. Okay, so this is my little light here. Okay, if it's too bright, just let me know. I'm going to come a little bit close and look into your eyes and pull them down while I'm at it, okay? So I'm just going to pull. Okay, so everything looks really good, right? Okay, a little bit of redness, which is normal, okay. There's a little bit of redness in your left eye, which is normal because of the pollen. It's crazy lately. Oh man, I cannot wait for it to go away. But other than that, the eye looks really good. I'm going to take a look at this eye. That eye looks really good too. Looks a little bit dry. I'm going to give you some eye drops before you go, okay? So now what I'm going to do is I'm going to have you look at my fingers, okay? Tell me which ones are moving, but I want you to look at my nose, okay? Which ones are moving? Good. 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 Awesome. Now I want you to still stay looking at my nose and tell me when you can see my fingers coming into your vision, okay? Good. Good. Awesome. Alrighty. So now I'm going to have you look at this chart behind me right here. It's called a Snellman Chart, okay? And I'm going to have you cover your left eye with your hand if you could. And tell me what letter this is. Good. And this one. Good. And this one. And this one. Good. And this one. And can you read this bottom line for me? Good. And what color is this? Okay, cover your other eye if you could. Good. Okay. What number is this? Okay. And what letter is this? And what letter is this? And what color is this? And can you read this line for me? Okay, start over here. Good. 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 Good job. Your eyes are perfect. What I want to do though is just double check that you're not colorblind, okay? Can you tell me what color this is? Okay, and this color here. Good. Okay, and this color. And this color here. Awesome. Now I've got two Sharpies here. Can you tell me what color this one is? And what color is this one? Good. Can you keep your eyes focused on this one right here? Good, and keep your eyes focused on this one right here. Amazing. All right. So since your eyes look really good, we're going to move on to your nose, okay? So I've got a light once again. What I'm going to do first, though, is palpate your nose and feel for pain, okay? Have you been smelling recently like you feel like you should be? Is your smell strong? Okay, does that hurt at all? Okay. All right. Good to know there's no pain. I'm going to take a look into your nose. So I'm going to have you look up. Okay, I'm just going to look at your nose on the inside and let you know what I see. Okay, so let's just look up into your nose. Let's look up into your nose. Everything looks really good. Okay, I do see that. This makes sense. Yes, okay. And just going to look through your other nostril. If you could just look up. Yes, everything looks, once again, everything looks really good. Yes, okay. Okay. All right, good. Your nose looks really good on the inside. Doesn't look dry or anything, which I'm amazed at since, like I said, the pollen's been crazy. But I'm going to have you smell this, and I'm going to have you just tell me what you feel like this smells like, okay? So I'm just going to spray it this way. What does that smell like to you? Right. That's exactly right. Good. And we'll have you try one more, okay? Just tell me what that smells like. Mint. Good. That is correct. Now we're going to move on to your mouth, okay? Do you feel like you've had any dryness in your mouth recently, or do your tonsils hurt at all or anything like that? Okay, so I'm going to look into your mouth with my other light. So if you could just go off for me. Okay, I'm just going to take a look at your mouth. Just gonna take a look. Yes, your throat looks good. Good. Okay, your throat looks really good. Your mouth looks good. I'm going to have you taste this. I'm going to put a drop on your mouth and just let me know what you taste, okay? Yes, that is perfect. That is exactly right. Now we're going to move on to your ears, okay? So what I'm going to do first is take a look into your ears with my light, if you don't mind. So I'm just going to take a look at your ear right here. Can you hear this? Okay, yes. The tympanic membrane does look pearl gray, which is normal. I don't see anything abnormal. I see just a little bit of earwax, but that's completely fine. That's completely normal. Like, a lot of people have earwax. Like, I think everybody in the world does, so don't worry about it. It's normal. I'm gonna look into this ear. Okay, yes, I do see that. Right, that looks good. Okay, the tympanic membrane is pearl gray. Can you hear this? Good. Everything looks good on the inside. Now I'm gonna have you close your eyes and tell me which ear you hear this sound. And this sound. And this one. And this one. Okay. So I've got this little hearing device. I'm going to create a vibration. I'm going to put it on your ear. Okay. This is going to be position 1 and position 2. And I want you to tell me which one sounds louder to you, okay? Good. And the other side? Good, good. Okay. Now I'm going to do the same thing, but I want you to tell me when you cannot hear the sound anymore. We're going to start with this ear, okay? Now, good. And this ear? Good. Awesome. Okay. Now we're going to do a little bit of a guessing game. Only 2 items. I want you to just tell me what this sounds like, okay? I'm going to do this a few times. Tell me what this sounds like to you if you just had to guess. Would you have guessed a stapler? Good. Okay. And one more. Hole puncher. Good, awesome. Well, you're doing amazing so far. I'm gonna finish off by just measuring your whole body, okay? So just relax. I'm gonna measure your forehead, your nose, cheeks, your other cheeks, okay, chin. Okay, and just smile for me. Good, okay, and frown, and okay, so I'm gonna check your arms. I'm gonna measure from shoulder to shoulder. One more time. Okay, and can you turn around? I'm gonna measure your back, okay? Good. Good. And I'm gonna measure you from your head to your toes. So if you could just stand up really tall, don't slouch, move your shoulders up. Good. Okay, looks good. And on this side, looks great. I'm gonna measure your feet, your left foot, your right foot. Awesome. All right, so your medical exam has gone really well. I don't see anything to be concerned with. Do you have anything that you think that I missed? Okay, I'm just gonna write you those eye drops prescriptions right now, okay? For Dr. Cat. She'll be able to give them to you tomorrow, okay? They'll be ready by then. Other than that, everything looks really good. We'll see you in a year from now. All right, sounds good. Take this card, and they will be able to give you that tomorrow, okay? Well, thank you for coming in. I am so glad that you chose me to do your medical exam. If you ever need anything else, you know where I'm at. And other than that, I hope you have a wonderful rest of your day, night, morning, whatever it is for you, okay? All right, we'll see you next time.